Thank you very much, Mr. Chairman, and good morning. I want to thank all of our witnesses for being here and presenting your very clear and succinct testimony. Let me ask you, going back to the continent of Africa, noting that there have been no reported H1N1 diagnoses. Surveillance, we know, is an issue on the continent. What healthcare systems, in terms of labs, in terms of healthcare workers, is an issue. Infrastructure. What do you think is going on the continent? I mean, do we believe? Can we anticipate cases, or do we believe that for whatever reason there just are no cases on the continent of Africa? And also, what should we be doing? And I was just reading the President's statement, which I think is a great statement, and I want to also commend him for his leadership, because we all recognize that not only is this a public health emergency and a humanitarian crisis, but also a national security issue that we have to recognize as such, and this is the way to address it within a comprehensive fashion. So what, in terms of the continent of Africa, what do you think are some of the key investments that we need to make to really begin to address this in a big way in terms of the spread of this disease and other diseases? And also, what do you think the real reason is that we don't see any signs yet on the continent? And none of the countries, as I look at this chart, have any cases at all.
I can start with the issue of what's going on in Africa. You know, one of the values of the investments that have been made in global health is the international network that we have. CDC has people in over 45 countries working on a variety of issues, things like PEPFAR, polio eradication, measles, and our global disease detection program. And we've been holding very frequent phone calls with all of our international staff to both share information of what's going on here and learn from them situational awareness of what is happening. Also, they have facilitated our providing these diagnostic kits for the new virus so that laboratories in some of these countries will be able to test right there without shipping to one of the WHO labs or here to the U.S. to CDC. We don't yet have confirmed cases from Africa, but I share your suspicion that that doesn't mean they haven't happened yet. There are lots of variables in terms of temperature and populations and travel, and so where the disease has been confirmed, so far it's been related initially to travel exposure to Mexico. At this point, with disease in the U.S. and Europe and New Zealand and many other places, you know, the risk for Africa continues. So one of the issues is how do we find out what's going on, and I think that's through our investments in laboratory capacity, epidemiologic capacity, training so that the next generation in these countries will be able to detect and respond, communication and information technology so that we can know what's going on and share that information, and really the governance that allows the different networks to interact. We're working not just with the CDC network, with the WHO network, with Pasteur Institute, of course with the AID missions. So I think that, and then the other comment is that some of Africa is in the southern hemisphere where we would expect a reverse season from what we are seeing. In particular, we have strong collaborations in South Africa, which does have very good laboratory capacities, and that's a place we're going to be looking intensively to understand whether this virus emerges in the summer.
And if I may add to the answer, I think it's reasonable to assume that this virus will show up in the subcontinent of Africa. The problem of detecting it will be significant. There are steps there. Your question really had a two-part component to a temporal component. What can we do now to ensure that we can pick up this virus at the earliest possible moment for the purposes of being able to track it, monitor it, and deliver life-saving interventions as needed? But the second part of your question had to do with seeing this as symptomatic of a broader array of challenges within Africa in terms of picking up new diseases and being able to respond. Specifically, I can say two things about that from USAID's side and, again, with our partnership with Centers for Disease Control. We are looking to have a consultation with CDC next week that we hopefully will include WHO and FAO, that will identify immediate actions that we can take, and part of this reprogramming of some of our resources will be specifically asking how can we make investments immediately with resources on hand to increase the likelihood of picking up this virus. So create a better, more focused and coordinated effort towards that end. Second part of the question has to do with the broader issue of being able to pick up diseases before they become large public health threats within the region. I mentioned to you that we have launched an emerging pandemic threats program. This is a 5-year down payment program that has as a central part of it investing in a network of laboratories within Africa specifically intended to increase our ability to diagnose both within animal and human populations new emergent pathogens that will be in a better position to signal when something novel is occurring and help us to more effectively respond. So that is part of a systems approach towards responding to the larger, more long-term challenges. So two-part, immediate consultations, reprogramming funds, and creating an opportunity to diagnose now and take simultaneous steps for the longer term.